Hi, my name is Ben Waitley. I'm the co-founder and CEO of Astron Health, and I wanted to tell you a little bit about the new Polaris report that we're launching. So as you know, molecular profiling transformed our understanding of cancer, but for most patients, it hasn't actually yet changed their treatment. So now nearly half of all cancer patients get molecular testing done, but only 13% of them receive a matched therapy. And that gap isn't a gap in the science, it's a gap in translating complex molecular data into clinical decisions. Translation is something that just isn't done well at the moment. And it's very complex and it requires a huge amount of research to do it well. Astron's Polaris report is here to close that gap. So the Polaris report takes each patient's tumor's multi-omic profile, so gene mutations, but also gene expressions and pathway overexpressions and underexpressions, and returns a ranked, evidence-scored set of treatment options. The options are ranked based on the quality of the published literature, on the quality of the drug target engagement, and machine learning-driven interaction predictions, as well as regulatory evidence, all combined together into a single framework, and that is the Astron score. So the Astron score is a single number that's given to each treatment option that allows you to see how well evidenced that is to help in each particular patient's case. The Polaris report contains an incredible amount of depth and complexity. We scan over 170,000 research papers to create each report, but we also want to make sure that it's as easy as possible for you to understand and make use of. And the Astron score is the piece that gives you that simple clarity. There are three things that the Polaris report does that I think it's really hard for an individual clinician to do on your own without it. So firstly, it identifies the best evidence repurposed therapies and adjuvant therapies. The report surfaces these options that can target additional pathways for a more complete treatment strategy. And as you know, there's a lot of evidence that if you're able to hit more target pathways with treatments, then that's associated with better outcomes. So that's really important. Secondly, it finds options for the other 87%. For the patients who aren't in the 13% who qualify for conventional precision oncology, Polaris helps the clinician to find those actionable biology-aligned options. And then thirdly, it synthesizes all of the latest clinical evidence, not only mechanistic rationale, but also trial data, dosing, lifestyle interventions, also timing of dosing, things like treatments that are best taken in the mornings. There's great clinical evidence for those. And it puts all that together into a format where it's ready for clinical use. And the result is this Polaris report, which really is the bridge that links molecular testing to meaningful treatment options for many, many more patients. That's the aim of the Polaris report. And I think that's what you'll see if you look through some of the other materials and read through the sample report. It's giving you that balance of real clarity on what the most highly evidenced options are for each individual patient, tailored to the details of the multi-omic profile of their tumor, but also drawing on really the entire pharmacopoeia to identify those best treatment options and ranking them. So it's got that simplicity of showing you the right treatments and the pathways that are relevant, but then you can also dig deep and find all of the detailed research that goes behind it. I hope you enjoy it. I hope you find this incredibly helpful to your practice. Please do let us know if you've got any questions or any feedback on how we can make it more useful.